Hello, everybody. I'm here with Jane Abbott. She's one of our massage therapists from the clinic. Today, we are going to take, hopefully not too long, but long enough that it's valuable, to talk about soft tissue injuries. That's what we're talking about. So the idea would be that just to expand the athlete's knowledge and understanding of what goes on. So you come to the gym, the workout has overhead squats, you're working through them, and you find your shoulder ends up sort of like tweaky or feeling like, I didn't feel great in the workout. Now it's still bothering me. And we're going to talk about kind of what's going on there. So I'll hand it over to Jane to carry on.
Awesome. Thanks, Jesse. So talking a little bit about the injury cycle is what we're going to get into today, and sort of what's happening to your body, why sort of like waiting it out or ignoring it isn't really likely to work for a long-term solution, and what you can actually do to make it go away or sort of recover in a more efficient way. So we're going to talk about some different steps of the injury cycle. So we're going to start with step one, which is the initial injury. So also known as like the tissue trauma. Tissue trauma is a normal part of building muscle. So when you feel sore from a workout, that is typically micro tears in the muscles, and it's contractive tension in the muscle. The body treats this stress in the tissue as an injury and initiates the repair process. This is actually how your muscles get bigger. A lot of you guys probably know this, but this is how your muscles grow, is because when they lay down sort of like the repair process, it does make your muscle bigger and stronger and willing to undertake like heavier loads going forward. What is not part of the normal process is when there's excessive tension or a strain, for example. This is not normal and it's not healthy for the muscle. And this can interfere with the healthy growth of the muscle by allowing them to remain shortened and in a contracted state. And this will typically lead to what we're going to sort of classify as step two, which is the inflammation. So tissue trauma leads to inflammation of the damaged area. Inflammation triggers the body's pain response, which activates protective mechanisms meant to prevent further damage. So at the microscopic level, we're talking about activation of tiny receptor sites called muscle spindles. These are stretch receptors that communicate with your brain about the length and changes in the length of the muscle, which then will lead us to what we're going to classify as step three, which is the muscle spasm. So when the muscle spindles are stimulated, microspasms can sort of echo through the muscle, creating further tension and shortening. And if you leave that unattended, then you get what we're going to call step four, which are adhesions. So adhesions are the result of the microspasm. So these are often referred to, like by the layperson, as like a muscle knot or sort of a nodule that you can feel in the muscle. They reshape the muscle itself. So they actually make the muscle have to work differently to work around it. So it creates an inelastic matrix of sort of like roadblocks that prevent the muscle from contracting and releasing as it's supposed to. So these untreated adhesions can actually become permanent fixtures of the soft tissue as the tissue repairs itself to cope with the demands of strength training. So this would sort of be the downside of pushing through an injury, is that your muscle is kind of having to work around this roadblock, and it's not maintaining its optimum position and health as you move through different stressors.
And this is where we're talking about scar tissue being laid down, right?
Exactly. Yeah.
So the injury, so you have an injury site in the muscle tissue.
Yeah.
You get that inflammation in there. And what's happening is your body's inflammatory response to that is laying down sort of a matrix of scar tissue to sort of fix that damaged site.
Yeah. And scar tissue, like I sort of like, I don't know if anybody played that game, like pickup sticks as a kid, where you just kind of drop the sticks and let them go. And they kind of just go in every which way. That's kind of what scar tissue does, is it just lays down in a very haphazard way, which is not like, you want ideally your muscle fibers to be moving in a certain direction. And that's what supports the strength of the movement in certain directions.
And this is where you see that with meat that you buy from the store.
Yeah, exactly.
Like chicken or stuff like that, you can see as you cut it open, you can see there's a direction or a grain to it, almost like wood, where this is how this wants to operate. And scar tissue would be like, just go in all directions.
Absolutely. Right? Yeah. And I've done dissections. We look exactly like chicken on the inside, just bigger. which if you're really into chicken, don't do a dissection. But it's a collagen fiber that lays down in that sort of haphazard way. It's not as strong as actual muscle fiber, and it's not as flexible, which what, when you sort of go to move a joint after an injury, that's why it can feel a little bit stiffer, because the tissue isn't created the same. So,
and this is just that initial response. Like this is just like, this has been damaged and we need a quick fix to deal with it, to allow the tissue or allow the muscle to continue to function like at all.
Yeah.
Is that right?
The body's really smart in that it will arrange, sort of a backup plan, like this sort of haphazard approach to allow you to continue to function, but it doesn't take into consideration efficiency or comfort. So it's not optimal, but it is functional, if that makes any sense.
Yeah.
So, yeah.
And so from there, so it starts, so it initially hits it with sort of a quick repair of this scar tissue matrix. And then what?
So the next part is, we'll kind of get into the healing process, but like in terms of the injury part for now, like what actually happens now is that this inflexible tissue that sort of exists within your muscles can cause a lot of postural compensations as the body attempts to find new ways of moving itself in spite of its limitations. So these sort of permanent adhesions can cause the body to function in a very different way. So the body wants to move and it will find a way to do so, even if it means using muscles and joints in a suboptimal way, which deviate from their intended functions, which kind of leads to sort of the final step in, sort of an injury is that where you have muscle imbalance, where repeated patterns of movement model the body in their image. And if this movement is suboptimal, then those faulty patterns will kind of become a little bit hardwired and really hard to sort of compensate from there.
And this is where we see the asymmetry start to show up in some movement patterns.
Big time. Yeah. Yeah. Exactly.
So then inside of this phase, then, what are like productive things to be doing?
So really this like kind of working through the healing process and how that kind of works, and where sort of coaches and practitioners can really sort of step in and be of assistance for you there is sort of being aware of movement patterns and working with a practitioner to help sort of break down that suboptimal tissue and, get it back to functional tissue. Like a lot of what we do as massage therapists is that we, when we're sort of stripping through a muscle, we're sort of stripping through it in a specific direction. It may feel like from, the person on the table that they're just getting sort of poked at, but there is a method to what we're doing that we want to rearrange that scar tissue in a more functional pattern is essentially what we're trying to do. And that way, when you go to move, like it's sort of, we're almost trying to get it to mimic the tissue around it and break it down so that it does become more functional. So,
and initially, should I ice and elevate? Should I rest?
Yeah, that's a good question. So let's maybe get into a bit of like the different stages of healing and what you should be focusing on at those points. So the sort of acute phase of an injury, which we call sort of like the first week of an injury, let's say like anywhere from like days 1 to 7 is usually what we would classify as the acute phase. And that would also depend on the severity of the injury. So inflammation has a bit of a bad reputation, but it is actually something you want to be happening because it's essential for tissue repair. Immediately following an injury, there is typically inflammation and bleeding in the injured area. So the bleeding may not be something that you can see, but it can be happening sort of beneath the surface. So this will usually result in, a bit of pain, some redness, a little bit of swelling, or even just some heat that you can sort of feel in that area. This is a cellular response that's happening, and it releases chemicals that are required for the healing process. So it allows for an increased blood flow to the area. And the increased pressure from the swelling in the area usually irritates local nerves, which is part of what is causing the pain for you. So as much as swelling, people want to get rid of the swelling, that sort of elevating and icing idea, you do want a certain amount of swelling because those are the chemicals coming in to sort of promote this, repair process. So depending on the injury and depending on the severity of it and what your tolerance is, there's a lot of debate over whether icing is something you want to do or not. There's kind of good arguments on either side, to be honest. Icing is maybe not something you want to do in the first like 24 hours, but to sort of control the swelling and the pain going forward, it could actually be really good. So, but you'll get a lot of different opinions. then you kind of want to
optimal recovery.
Yeah, you kind of want to embrace it a little bit because it is doing something useful for you. Where it becomes a problem is that if something remains, especially on like a distal extremity, like your hand or your foot, if there is sort of a lot of, liquid and stuff sitting in that area for long periods, like if the swelling is sort of just staying like that, that can sort of create a bit of like a sort of bogging down of stuff in there, and the scar tissue can accumulate.
The like my understanding was the idea would be optimally what we've got is it would be in general, because it's not always the case, but avoiding ice, because ice is just likely to slow down the process of like repair materials getting into the area. It just sort of bogs down the site, although it may be like topical and feel better, or even as a placebo for like I'm doing something positive about it. But it can slow the process of healing because it's disrupting material moving like in and out.
But in sort of the later stages, it can actually promote things moving. So when you sort of put blood on it, like ice on an area, and it creates a sort of the blood to leave the area, when you remove the ice, then you get this sort of fresh inflow of blood, which does bring sort of like healthy blood and nutrition to the area. So there's ice is
and then that's
not
the question of like contrast then, right?
Yeah, contrast is probably the more ideal. And that would probably be sort of more the late acute, sort of subacute phase. You'd want to focus on that when the healing process is already underway. So,
and then the same thing would be true for NSAIDs, right? Like ibuprofen, Advil, like those things are not in a different way. They're disrupting the signals going out that repair is required in the area.
Yeah. And like, one of them is sort of classified as like a pain reliever and one's an anti-inflammatory, and they do different things, and they are metabolized through different organs in your body. So like ideally avoiding the anti-inflammatories because you want inflammation. And if you need to take something for a tolerance thing, take something that's more pain focused versus anti-inflammatory.
Right. Yeah. And then positively then, if we want material to come into the site, inflammation is okay, then would be productive then to look at like what can we do to remove waste material.
Well, that's where blood flow is kind of your friend, right? So you do want to try and move it within, a sort of a healthy way, depending on the extent of the injury. Like you don't want to do anything that makes it worse, but you do want to, you don't want to just sort of sit down and put your foot up. If you've sprained your ankle, you do want to try and move a little bit, just to get that like circulation
piece, right? Like,
as
long as you don't want to be, don't want to create more problems. But movement is going to promote blood flow. And what about lymphatic drainage? Like being able to move that direction either by like, I guess, massage or taping or electrostim.
Yeah, those sort of like, I can't really speak to the taping and the electric stim because those aren't really like the taping. I can a bit, but the electric stim isn't really within my scope. So I probably be better for a physio to answer that kind of a question. But anything that's going to, increase the circulation, which stimulation would, even just changing your position will, like, a really common thing for like stage runners to do between stages is to like lay with their feet up the wall, because all the blood kind of drains out of them. And when then they get up and move, blood goes back into them, and it sort of creates that bit of a flushing system. So those kind of things are ideally what you want to be doing when you're sort of working with an area with an injury. And that's where like, lymphatic system, that's where like the practitioners can be of help to you, because you may not be able to really put pressure on the area, but we understanding sort of the areas around it and the blood flow directions, like we can actually help quite a bit with decreasing swelling in areas without even touching it, because we can sort of work the compensation areas around it.
So are you saying there's productive things I could do even in the acute phase that are different from laying on the couch, feeling super sad, eating poorly, taking some ibuprofen and putting ice on it?
You can do those things, but there's definitely options outside of that. And
there's more options available.
Definitely more options available. And even like working with the coaches to be like, look, this is what I'm dealing with, and I really want to move. Like, what are some good options? Like, you guys are all very well educated in that area, and you certainly don't want to make anybody's injury worse. Like, you've got you've got a really good conservative approach to like, okay, well, let's see how this goes, and then we can go from there. So,
Okay, cool. So acute phase, moving from the acute phase.
So past our acute phase, we're kind of moving into the subacute phase. So this can begin sort of like day 4, anywhere up to like 6 weeks or more, depending on again the extent of the injury. This is usually where people start to hurt themselves because the inflammation settles down. Your body is beginning to repair that damaged area by laying down collagen. And like we kind of talked about before, the collagen fibers are put down in a pretty disorganized way. So it is weaker and less flexible than normal tissue, but you do have less pain typically at this point. And this is where often there's that high risk of re-injury because people kind of want to resume their normal activity, but the new collagen fibers, they're weaker and less flexible. So they can't actually withstand as much stress as normal tissue can. So this is often where people will be like, I gave it, a week and it felt good. So I went back and then they sort of re-injure the same area, or re-aggravate it.
I'm not totally sure, but I believe this is called the trises phase.
Yeah, let's see what I can do. Yeah.
I just thought I would try and see, and it turns out it doesn't feel good enough yet.
Yeah, and it's also where like the pain isn't as intense, so it's really easy to convince yourself that you can push through it. And this is where sort of increasing treatments or really working with a coach to do modifications can really start working on regaining a healthy range of motion and like healthier movements, because it's at this phase, this is where you're more likely to start moving in a way that's not optimal, because if I'm just realign this slightly, it doesn't bother me. But what you're doing is actually going to cause bigger problems down the line.
Yeah. So. Yeah. Attention to detail on how you're moving. This is a good one that we can see in the squat, actually. This is where you can have an athlete with a knee issue, hip or ankle piece, and you'll see a very, very prominent shift through that range of motion. You're like, oh, man. And it can be dramatic at the time, but if dealt with correctly and controlled, ease back in, it actually can be corrected and brought back up to previous or better.
And I think to be fair to athletes too, like a lot of athletes probably don't even realize that they're doing that. They're aware that they had an injury, but they think they're moving properly.
Totally. Yeah, definitely.
I definitely see it a lot with like, especially arm movements and stuff. Like you ask somebody to sort of show me your range of motion with your shoulder, and they think it looks fine. But it's like, no, your whole body moved to the side when you had to bring it in this direction. Like you're compensating. That's a big red flag. So, but they think it's fine. So
totally. That's where help does make a big difference, right?
Yeah. And just get people to watch you move and see what it's looking like, because there's probably, everybody's got imbalances probably already just from like day-to-day activities, like positions you sleep in cause imbalances. Your sort of day-to-day desk job will cause a lot of imbalances. The fact that you drive, an automatic or a manual is going to make a difference
100%.
in how your hips sit. Like there's a lot of things. And if you drive a lot, that's going to, Yeah, exactly. And the people that don't shift, that their right leg's doing everything and their left leg's just doing nothing. So, I think so.
And honestly, that's also, plays into like why we do the training we do. Broad, general, inclusive, is that that we're trying to cover off all the bases and make up for those kind of specialty movements, which, or lack of specialty movements, like just, sitting a lot, driving a lot, like those sort of pieces are hours spent in a certain position, and that optimally when we're covering off in the gym, then it becomes those pieces of like, hey, this is why I do this, so I don't run into so many problems in my job.
And it's a trade-off too, because you got to think like you spend, hopefully 8 hours sleeping, and you spend 8 hours a day working in a certain position, and you maybe spend an hour to a couple hours in the gym, So what is going to have more impact on your body? It's probably more like your day-to-day stuff versus your gym stuff. But if your day-to-day stuff is creating a lot of imbalance, when you go to the gym, that can be what sort of exaggerates it or creates a problem. Yeah,
absolutely.
Yeah.
Which can be productive as well.
Yeah.
Because as long as it's not a big, like, as long as it's something within, like, ideally we find these weaknesses in the gym, and they're exposed there, and we can deal with them either as a range of motion issue or as a strength weakness issue inside of that environment, so they don't become injuries, or problems
Yeah, no, absolutely. Yeah, no, I think the people that are, that are sort of doing strength training to compensate for their life, or, help support their life, are the people that are going to last longer. So,
Yeah, yeah,
yeah.
definitely. From there,
So we
subacute
were
phase.
talking about the subacute phase. Just want to make sure I touch on all the details of that. We sort of move past subacute. You hit the remodeling phase. So this can start as early as 2 to 3 weeks, up to months or even years, again, depending on the extent of the injury. So as healing progresses, your tissue should improve in quality, organization, and the strength of it. The remodeling phase does focus on sort of increasing the cellular organization of the collagen fibers. So increasing the strength between the bonds of them and sort of resuming its flexibility. In this phase, adding stress to the tissue is really important to realign the fibers along sort of the proper lines of stress, which will allow the tissues to accommodate increased loads that you want to place on them. Treatment during this phase is really focused on regaining full range of motion and improving, like increasing strength. So sort of working your way back to sort of normal in a really safe, efficient way. So that can, like I said, go on for months or even years. And that's where you want to get like a good range of motion before you start really adding loads of strength to that range of motion. You want to make sure that you can move comfortably and efficiently through that range of motion.
Yeah. Reestablish proper quality range of motion and then load.
Yeah. Yeah, exactly. And we have talked quite like a bit about collagen. And I know that's something that a lot of people sort of, know a little bit about, but collagen, just to kind of highlight it a little bit, it is one of like the most abundant proteins in your body. So it's helps with all your bones, skin, muscles, tendons, cartilage. I think it makes up about 60% of the cartilage in your body is collagen. So it does a lot of things, and the things that really we do produce it naturally, but the things that do stop the production of it really quickly are things like excess sun exposure, smoking, alcohol, lack of sleep is a really big one, and not exercising also decreases the amount of collagen that you produce. So, doing the opposite of all those things, so things like sunscreen, getting really good sleep, and a lot of it. Obviously, try to avoid smoking, and even secondhand smoke can have an impact on it. I don't know if there's any gym smokers. That would be weird, but
there's probably.
Yeah, and even just avoiding sort of stress can break it down a little bit or decrease it. Yeah. And exercise is obviously a really good thing to promote it. So, yeah.
And supplementing, worth it, not worth it, in your opinion?
That's a good question. I think I don't think there's any harm in supplementing. I did read a few articles to sort of talk about, because like a lot of people have put collagen into their like coffee and stuff like that. Totally. And there's a lot of, and there's nothing really saying that it's doing a lot, but it doesn't say anything that it doesn't help either. Like the couple studies I read, it's a little inconclusive right now. But collagen has been a big part of like skincare for a long time. Like, a lot of sort of cosmetic products will have a lot of collagen in it that you apply to your skin. And it's from the studies that I read, there's more evidence that ingesting it is more effective than just putting it on your skin. So from that standpoint, I would say supplements, like if you're doing them and you find that they're helping you, then, fill your boots. So, but you are producing it naturally too. So don't feel you have to rush out and start, chugging all the
just sticking
collagen.
Same as everything else, sticking to the primary pieces. Get good sleep, eat well, stay away from booze, cigarettes.
Sleep is a huge one for everything. Like sleep is when your body repairs everything. Like that's where your cells regenerate when you're sleeping. And so, I can't really say enough about getting good sleep, like quality sleep, and try and get as much as you can. So, which I know some people are really good at, and other people are like, oh, I only need 4 hours. I'm like, it's not optimal, but okay. Yeah. There's living, a certain way, and then there's living optimally. They're pretty different. So
not same.
Yeah, exactly.
That's a point not to be that piece of saying that it could take up to years during that remodeling phase is actually, I find, super interesting.
Yeah.
Because you can see that on the surface, right? Like I've got like scars from a long time ago that I still like, oh, that's different than it was even a couple of years ago.
Yeah.
Like it is fading, it is changing, it, you know, might never go away, but it's like over an extended period of time, definitely has been the case. And certainly with my Achilles and my shoulder,
Yeah.
I feel like I saw notable improvements for the first 12 months for sure, but then continue to see improvement and positive change in those in the subsequent years.
Yeah, and you'll probably notice like, and everybody will notice like injuries that, you know, impacted them when they were younger might sort of revisit a little bit as you get older, because we actually produce less collagen as we age. Like that's just a normal part of the aging process, and that can start to play a bit of a role in recovery and even just sort of injuries sort of resurfacing. So, and depending on how much scar tissue you have in your body and what sort of attention you got to injuries at the time. And even what kind of tissue got damaged, like, you know, having a muscle tear versus a ligament tear can heal differently. Ligaments don't typically heal great. They're never usually the same as they were before, just because that's the nature of ligaments.
Blood perfusion.
Yeah. And I kind of equate ligaments to, they're sort of like the duct tape of the body. And it's like once duct tape kind of gets a little messed up, it's really hard to get it good again. It's kind of how I visualize it. So, whereas other things you can fix it, you know, but duct tape, it's like once you've once it folds on itself, it's like, okay, now it's screwed. So yeah. But that's where increasing the strength around the damaged ligament, like that's where muscles can kind of kick in and be your friend and sort of help support you, because your ligament probably won't be a totally 100% again.
Yeah.
So
I've certainly experienced that myself with both ankles. Having them both MRI'd and having a lot of ligament damage in both. Yeah. But both MRIs came back as like the joint surfaces are actually really healthy.
Yeah.
And the muscle tissue supported them quite well.
Yeah. Yeah. No.
Those pieces are super interesting. Sweet. Other pieces on the list?
I think that was it. I think that's all we wanted to talk about today.
Yeah. Yeah. Super simple. Awesome. I think we'll leave it there. Hopefully that's super valuable. Anything that comes up with questions, comments, concerns, queries, a conundrum, you can post a comments. You can find Jane both in the gym and in the clinic. You will find me in the gym. So reach out to any of us if you need help.
Awesome.